Well, good morning, everybody. Welcome to our next Community of Practice presentation, which is entitled Remaining Connected While Social Distancing. My name's Tom Mulvaney. I'm the General Manager of Impact and Strategy at Family Life, and I'm joined today by some amazing panelists who are going to discuss social isolation and loneliness with us. And we look forward to your questions and comments throughout the presentation as we learn together more about these issues. Jody, happy to bring our full panel up on the screen just so we can have a quick look at everyone. So we've got David Perry joining us from Neighbourhood House Victoria. We've got Chris Schildt and Rebecca Lee joining us from Beyond Blue. G'day panel, great to have you here today. And we've got Jody who's moderating our session. Jody's from Family Life and is our Community Change Manager. We'll come back to our panelists throughout the presentation. We've got some slides that we'll talk to, and you won't see us up on the screen while we're talking to those slides, but at the end of the session we have a Q&A and we'll join you live for that. Thanks, Jody. So this seminar extends our broader discussion around community change. As we've connected as a group, as a broader community of practice, we're looking at the different elements that make up our approaches to community change. And today, I guess we're focused on the key themes around community innovation and what we can be doing collectively to engage community and collaborate around tackling the issues of loneliness and social isolation. Thank you, Jody. So before we go any further, I'd like to commence with an acknowledgement. And on behalf of Family Life, I'd like to pay our respects to the traditional owners of the land, the Bunurong and Bunurong people of the Kulin Nation, in whose ancestral lands I join you from today. We would like to acknowledge elders past, present and emerging, and those of you who have joined us today from other communities across the country and internationally. I encourage you or invite you to think about the land that you're on today and acknowledge the traditional owners of the land that you join us from. It will be different to me. I'd also like to acknowledge all the work that goes into setting up a seminar like this. First and foremost, I'd like to thank all our participants for joining us in today's conversation. Demonstrates your investment in community change, your commitment to collaboration, to learning and to working differently to make the world a better place. I'd like to acknowledge our presenters who join us from Beyond Blue and Neighbourhood House Victoria today. They volunteered their time to join us, and we're so very grateful to bring their expertise into this conversation. And I'd like to thank my colleagues at Family Life who put so much energy into making these work. Jody and Asha, thank you very much for all your time in getting us going today. At Family Life, we're learning more and more about facilitating these types of connection points. Ideally, we'd be in a room together, but currently that's not possible. And for those of us joining from Greater Melbourne, even less possible. So we're not going to be without our glitches today, and we appreciate your patience as we move through this together. We're here to talk primarily about loneliness, which is a feeling that is distinct from being socially isolated. And our panelists will talk a little further to that distinction. But loneliness is a perceived deficit between actual and desired quality of relationships. And their perception is really key. I can be surrounded by people, yet still feel lonely. The feelings will be experienced differently by different people. And again, we'll hear more about what that can look like. But you can imagine, and maybe you've sat in a room with somebody who's experiencing loneliness, and you'll find that there's a really strong denotion of hopelessness. There's often a reduction in energy and enthusiasm. and you can feel like a real burden on those around you. It's linked with things like depression, anxiety, and social isolation. We don't fully understand what causes loneliness, and that's what's brought us together today. I can't wait to hear more from our panelists about loneliness and about social isolation and why the two are different. And I really want you to think about how loneliness feels, because it's that feeling that we're coming together to try and change for those who do experience it. We've got a small clip just to creatively demonstrate part of what it might feel to be lonely. And then we'll get going with our panelist presentations. Just want to acknowledge the stand art clip there and how we're all trying to find ways to unpack this issue and communicate about it so that we can change the story together. And once again, thank you very much for joining us today so that we can collaborate on changing the story of loneliness. So we briefly saw our panelists earlier. I'm just going to give you a quick introduction to each. So Rebecca Lee joins us from Beyond Blue and works across the organisation to embed strategic policy in all work, particularly supporting the work of the Chair and the CEO. Rebecca is the Diversity and Inclusion Lead, overseeing the organisation's focus on reaching those people most in need of mental health support. In particular, this focuses on Beyond Blue's commitment to social and emotional wellbeing for Aboriginal and Torres Strait Islander peoples, through the implementation of a reconciliation action plan and a cross-functional strategy. We're also joined by Chris Schildt. Chris is a project manager for mental health literacy and a clinical advisor for Beyond Blue. His mental health literacy work includes overseeing large-scale projects to build the mental health literacy of Australians, such as the 3-year multi-million-dollar anxiety campaign. In his clinical capacity, he is assisting with Beyond Blue's response to the coronavirus pandemic, both internally and externally. And Chris is a mental health nurse. Finally, we're joined by David Perry, who has 20 years of experience in the Neighbourhood House sector and is currently the Policy and Research Officer with the sector's Victorian peak body, Neighbourhood Houses Victoria. With a background in community development, David began work in the sector running a neighbourhood house in regional Victoria. His interest in broader positive social change led him to the policy and research role he currently occupies. His recent research, Connecting a Diverse Victoria, is an analysis of over 47,000 Victorian neighbourhood house participants and their survey responses. We've got a jam-packed agenda today, where we'll hear from David, Rebecca and Chris before we move into a discussion where I'll facilitate some further discussion around the impact of coronavirus on social isolation and loneliness before we move into a Q&A. And just a reminder that we welcome your questions and comments throughout today's presentation by using the Q&A function at the bottom of your screen. We'll work to close by 11 a.m. this morning. Thanks, Jody. So just a reminder that once again, many of us find ourselves in a lockdown, having worked hard to respond to the impact of COVID-19 over the past 4 to 5 months. I think many of us found that we thrived through that heroic phase. We experienced high levels of energy and we changed the way the world operates. We changed the way our sector works. And we experienced, I think, some great joy. We saw the potential and opportunity in these new ways of working. But many will feel that they're stuck in that disillusionment phase, or that they're kind of oscillating between crisis responses and then back into feeling disillusioned about the potential longevity of our experience at the moment. I think it would be remiss not to paint this picture before we move into a discussion around loneliness and social isolation, because while we don't understand exactly what causes loneliness and social isolation, we do understand the many variables that intersect to enhance those experiences. And COVID-19 is perhaps the biggest example we've seen. So we'll be talking about this trajectory throughout today's presentation and trying to understand the context that's at play here and how that exacerbates or influences social isolation and loneliness. I'm going to throw now to David Perry for a presentation around the key findings from Neighbourhood House Victoria. Thank you, Jody and David.
Thanks, Tom. I'd like to start, and if we could have the next slide, Jody, just talking a little bit about where my interest in this comes from. And as Tom mentioned, and I want to thank Tom and the team at Family Life for inviting me, I spent my early years as a community development worker running a neighbourhood house in rural Victoria, and the thing that always impressed me was not so much the manifestations of loneliness that Tom talked about, but watching that change as people built relationships. And I learned pretty quickly that neighbourhood houses, as much as anything, are actually about relationships, and watching how that expansion of people's networks and building confidence and so on enabled them to participate more fully in their lives and have more control over their own lives. So that's kind of how I became most interested in this area of social isolation and loneliness. And there's about 400 of those neighbourhood houses now across the state. And any of those who are listening today that come from neighbourhood houses, that would not be an unfamiliar story. If we could look at the next slide, Tom's talked about this a little. But it's really important that we understand the differences between the terminology, because it's often kind of rolled together, and there's reasons why that's so. But if we're thinking about social isolation, what we're talking about is an objective state where people it's measurable. So the number of people, of contacts, and the extent of the networks that people have is really what that's referring to. So it's the absence of significant numbers of connections. Loneliness, on the other hand, is a felt experience, and the two are not. You can feel lonely and not be socially isolated, and you can be socially isolated and not feel lonely. And the third concept that kind of gets rolled into this is that of living alone. So again, living alone is an objective state, but it is a reasonable predictor of both social isolation and loneliness. So keeping those three separate is kind of important. One of the more important things, though, is that in terms of strategies to address social isolation and loneliness in particular, there's great similarities. So the approaches to dealing with both are quite similar, although with regard to loneliness, sometimes additional kind of interventions may be helpful. And we'll talk a little bit more about that later. Could I have the next slide, please, Jodie? Beautiful. So, of course, the question is why all of this matters. Why are we interested in this state of loneliness? The short answer is it's really bad for you. So you can see there are a list of conditions, adverse health outcomes, and even criminal activity that have been associated in what is actually a vast volume of literature looking at the issue, both nationally and internationally, of social isolation and loneliness. In effect, one study basically concludes that it contributes to early mortality. So ultimately, you can die younger than you otherwise might have because of your state of isolation or loneliness. So it's a significant health concern. If we look at the next slide, it looks at the extent. So how big is this problem in Australia? So this is all Australian data from a number of sources that are listed down the bottom there if people want to follow this up later. But you can see that it's impacting at any time. Now, bear in mind, this is pre-COVID-19 data. So one would guess, and I'm sure Beyond Blue will clarify some of this, that the situation's actually deteriorated in this COVID-19 period. But going back when this research was done in 2018, 1 in 4 Australians reported experiencing an episode of loneliness, and 1 in 2 say that they feel lonely at least 1 day a week. You can see the average number of close friends has declined over time significantly, and that 1 in 4 Australians see their close friends only monthly to less than once a month, I should say, and 8% don't see friends regularly. Men, 1 in 4, have no or few social connections, and almost 30% of Australians rarely or never feel part of a group of friends, and then 22% rarely or never feel they have someone to talk to. 1 in 4 young Victorians reported problematic levels of loneliness, with young adults most affected rather than the teenagers. It's the younger adults who are experiencing that more acutely. And 1 in 10 Australians aged 15 and over report lacking social support. That's a gloomy picture, but it tells us, the size of the challenge that's before us all in trying to improve that situation. If I could have the next slide, please, Jodie. One of the things that astounded me was how age is not really much of an issue when it comes to people's experience of loneliness, with very few exceptions. So you can see from this data from the Australian Psychological Society that people are experiencing loneliness at very similar levels across all kinds of age categories. The one on the very end, at the sort of bright yellowy green colour, is people over the age of 65 who report lower levels of loneliness. But it's important to know that that changes as people from around 75, statistically from age 75 and on, that starts to deteriorate. And a lot of that's associated with loss of lifetime partners, of course. So that particular graphic kind of hides that phenomenon. So it spans the age groups. Can we look at the next slide, please? As Tom mentioned, we conduct a survey periodically with the assistance of the Department of Health and Human Services, where we actually ask the participants at neighbourhood houses. Now, there's about 200,000 people going to a neighbourhood house every week. So it's a major sort of undertaking. So we conducted over the course of a week in 2017 a survey of participants, and they self-complete that survey. And we had about over 47,500 people complete that. So we have a really good set of data around people's experience of attending neighbourhood houses. And what we can see here is they get to identify why they came and what benefits they reported gaining from attending. And as you can see, a couple of those relate to social connection, basically. So this idea of meeting new people and making new friends and spending time with other people. Again, what's interesting is that it doesn't matter, sorry, let me reframe that. Regardless of the activity type, for some people, they experience a social connection type benefit. And whilst it's stronger in certain things, like you can see there for social groups and people doing courses and classes, there's a higher rate of identifying those kind of social connection benefits. But people are gaining those benefits from any activity where they're spending time with other people. And I think that the differences are important, but also the fact that they can gain benefits from all things are also important. In that study, if we look at the next slide, what you can see is how those two measures deviate over time, and this is a really important observation, particularly from a policy perspective, and how we resource activities. So what you see there is that the idea of making new connections, so building your social networks, stays relatively constant or within a fairly narrow band over the life course, but it becomes less significant for people as they age. So maintaining existing social connections becomes the dominant of the two as people get older. What that means is that there's a need to have activities that bring groups of people together that are ongoing over long periods of time to enable people to maintain those social connections. And of course, anyone who's out there in the field would know that kind of funding is incredibly difficult to come by. But this chart says that it's something that we need to be conscious of. If we move to the next slide, the key thing, I think, for us, I think one of the biggest challenges, firstly, is it is a community-wide issue. So there are significant costs to the community as a result of social isolation and loneliness, and a lot of those land in the health area, but they're also in productivity, and there's been all sorts of estimations of the costs internationally. But we also need to be mindful that there are social and economic structures that contribute to the problem. And they are things like an inadequate welfare system that deprives people of the resources to be able to afford to engage in lots of activities. You know, people having to move to other places to get work, and particularly that lack of local employment for young rural Australians who are forced often to leave their town of origin or location of origin in order to find a job. Discrimination is still a major problem, and particularly we hear about that. Interestingly, we see that for people with disability, they report much stronger social connection benefits in the neighbourhood houses than other cohorts. The way we incarcerate Indigenous, the mentally ill, and people with intellectual disability, disconnecting them from their such important social networks, affordable housing, even just the divisive and populist political rhetoric that we're experiencing and the associated media narratives that contribute to people's isolation, in that they're unwilling or prevented from feeling comfortable going out if they happen to fit into those kinds of categories, that, like the unemployed, who are so often poorly labelled. So I think as we think about how we address this, I think we need to be mindful we have to work at both levels, at the structural level as well as at the individual level. So I'll hand back to you, Tom.
Thank you so much, David. It's amazing to hear from over 47,000 people who've responded to your survey. David, a quick question. What's the average age range of the people who do respond to that survey? And is there anything else you want to tell us about those participants?
Yeah, so it's a diverse range of people from different cultural backgrounds, people who experience disability. I think the one thing that, is fairly common is that generally they will disproportionately be experiencing some form of disadvantage. So they are predominantly women, so about 75% of them are women, but there is a significant cohort of men, and often older men associated with, so there's about 100 men's sheds, for example, that are run by neighbourhood houses. So there's a lot going on there, but it is a really diverse group. That's the report's available actually on our website, and anyone can go and have a look at that. But it does cover the diversity of Victorians. The only group that was kind of underrepresented to some extent was the COLD community, and in part that's a reflection of, the language challenges when you're administering a survey.
Thank you, David, and thanks also for the work of Neighbourhood House Victoria. I think we're hearing that connection is the antidote to loneliness and social isolation, and what an amazing thing that 47,500 people can access a resource like neighbourhood houses to experience that connection. And thank you for painting the picture around some of the systemic disadvantage that our political and social systems perpetuate, enhancing, I guess, the experience of loneliness. We're going to hear now from Beyond Blue and Rebecca and Chris talking us a little more about loneliness and social isolation and how that's experienced by people across Australia and the world. Thank you, Rebecca and Chris.
Thanks, Tom. I'm going to kick off. So Jodie, if you want to jump into the first slide. David's done a great job of framing up, I suppose, the wider we care angle when you think about loneliness, isolation, and its intersection with mental health. So there's obviously plenty of commonalities, and as the numbers show, we all feel lonely from time to time. But it's these long periods of loneliness or potentially social isolation that can actually have a negative impact on our mental health, our physical health, our social health. And this slide, I guess, is about just bringing to light some of what those signs might look like, some of those warning signs about, when loneliness starts to become a problem. And I guess it's when these signs and symptoms start to show themselves that we need to think about this kind of from more of a mental health lens, or certainly that's the way that we look at it. So things like low levels of energy, lack of motivation, trouble sleeping, and physical symptoms, even things like headaches or aches and pains. Jodie, if you want to jump into the next slide, I think what's great, I'll just wait for the next slide to come up so you can see the visual, but I think what's really helpful is that we're now starting to accumulate the evidence base in this space. So this image is from research by Michelle Lim and colleagues that actually shows there is more in common than just signs and symptoms between loneliness and mental ill health. So this two-way relationship shows us that if you experience loneliness, you're actually more likely to experience depression or anxiety. And if you have an existing depression or anxiety condition, you're also more likely to experience loneliness. I think this is really important because it means that although they are distinct things, we do need to consider them, you know, going hand in hand. I guess we need to think about, for those people with an existing mental health condition, what we can do to support them to stay connected, what we can do to, I guess, prevent that loneliness from coming in, but also why it's important to act upon loneliness before it gets any worse. So if we jump into the next slide, Chris and I thought maybe one of the useful things to do would be to tell you about, I guess, what we've been doing now. And I think, you know, David's presentation really nicely framed up sort of what's been happening in the space prior to COVID. And I'll just wait for the next slide to come up. But thanks, Jodie. In the context of COVID, like I said, we thought it would be useful to talk about what we've been focusing on in this space to mitigate loneliness, to mitigate a lack of social connection or physical social connection, and to support good mental health. So we were fortunate to receive some government funding to set up a dedicated coronavirus mental wellbeing support service. And the aim of this was for there to be a nationally available service that was specifically designed to deal with the impacts of COVID and how that might play out for people's mental health and wellbeing. Is very specifically focused on the wellbeing, prevention, early intervention end of things. So it was designed for everyone to be able to support their coping strategies to stop them becoming mentally unwell, but also to support people who might be living with an existing mental health condition to prevent symptoms of deterioration during this time. It's intended to be simple with clear language, information and support options. The language is very much focused on well-being again, so it's not I suppose, exclusive to mental illness. I guess the underpinning principle is that this service is intended to be responsive to what the community needs. And Chris will certainly talk a little bit more about this as we go through. So Jodie, if you mind just pulling up the next slide. So just quickly to give you an indication of what the service includes. So there is a phone support service that is staffed by mental health professionals who've specifically been trained for this sort of purpose, for the COVID context. They're able to link people to a range of other supports, recognising that feeling mentally unwell or feeling like you're unable to cope is just kind of one element that's happening at the moment. So they have links through to financial assistance, to family violence and alcohol and other drug supports, obviously the government advice and a range of other services. Sorry, I lost my thought there. There's the dedicated digital site, which I guess is where people are initially channeled through, has a lot of online advice and information, links to digital tools, and obviously links in there to our online community forum. So since we launched the site at the start of April, it's actually evolved quite a lot in response to what the community has told us that they need. So through a range of things, including what we're hearing from people through the support service itself. But for instance, the online content has evolved as well. You know, at the start, we were talking about topics like coping with isolation at home. And unfortunately for many of us in Victoria, we're talking about that again. But the content then evolved to reflect the changing situation and the change in restrictions, and you know, some of the more recent content before Victoria's situation changed again was about, you know, discussing anxiety around returning to work. So the idea was that this could be very interactive, I suppose, with reflecting what the community was asking for. So just quickly, I'll jump into the next slide and then hand over to Chris to tell you a little bit more, but just a really quick snapshot, I guess, of what we're seeing in terms of who's reaching out to this. So the digital platform had around 500,000 users in the first 3 months. So the link through to the online forums initially takes people through to a dedicated thread about COVID, and that had around 800,000 page views in that 3-month period. To give you some indication of our usual traffic to the forums, we usually see around 100,000, a bit over 100,000 per month. So you can see that that's substantially higher when you're getting 800,000 page views in 3 months. In terms of calls to the phone counselling service, well, I think we're sitting just over the 10,000 call mark. But what we've also seen is a huge increase in traffic to our regular support service line. I think the stat I had heard was, you know, something like 60% greater than this time last year. So I'll hand over to Chris to give you a few more details, starting on the next slide.
Thanks, Beck. So I guess at the moment, I think that we heard yesterday that the latest stat was about 1,000 contacts a day at the moment to the coronavirus wellbeing support site. So I think that's definitely been increased in the last week, and with the majority of calls coming from Victoria. So the most common reason that people have been contacting the coronavirus mental wellbeing support line is actually isolation, which is then followed closely by anxiety, worry, and depression. In terms of the coronavirus mental wellbeing support site, 6 of the top 10 most visited pages are coming from the coping with isolation and being at home subpage. Now, that's a bit of a varied content on that page, but I just thought I'll give you a bit of an indication. Sorry, that figure comes from the last 7 days, but I thought I'll give you an indication of some of the names of the articles. So that the number 1 article in the last 7 days is 10 ways to take care of yourself. Number 4 is ways to look after your mental health. And number 7 is ways to keep loneliness at bay. So we can see that, like, you know, loneliness and social isolation seem to be issues for people accessing the site at the moment. And if we could just jump onto the next slide, please, Jodie. So one of the things that I thought I might let you know about is the coronavirus community co-design project that we're working on at the moment. So what we're doing is we're trying to understand whether or not the services that we're providing are actually meeting the needs of the community in terms of the coronavirus, and what work we could be doing better to meet the needs of the community during this pandemic. So this project is actually a pretty big project, and we're following 30 people, most of whom have a lived experience of mental health conditions or suicide, or are carers for people with a lived experience, and we're following those people for about 6 weeks. We're having them engage with each other through different forums, either online, they're doing individual interviews, we're also having them engage in workshops, and it's also not only to understand what their challenges that they're facing at the moment are, but really to workshop some solutions to what they're facing at the moment. And just, you know, we're still 4 weeks into this process, but some of the themes that are coming through at the moment, and I guess this won't be a surprise to most people, is that strategies, supports, relationships, and familiarity with yourself and the mental health system make it easier to maintain good mental health. But one of the things that we kind of, I guess, didn't, I guess thinking about it now, it kind of makes sense, but we didn't expect it, was that, you know, those people that had these in place prior to COVID were better prepared and seemed to be managing better. And what that has meant is that often the people that had established mental health conditions seem to be coping better than those with emerging mental health issues. that, you know, with the exception of a few participants noting, I guess there are a couple in there that had limited support networks going into the project that seemed to be having difficulty, and that there are also some people that had supports around them but don't feel that their supports fully understand what they're going through at the moment. So they are also having difficulty at the moment through this process. If we could just jump to the next slide, Jody. And we thought we'd just pop in there as well some of the common themes that are coming through from the forums. That you know, that forum, that page that we're getting 800,000 views to. Lots of the themes coming through from that are about the sadness of being isolated, especially those among the senior members of the community. And how working from home has impacted on people's mental health conditions. There is also some expression about the uncertainty of going back to normal, or a sense of fatigue as restrictions continue. And you know, and I guess that this also won't be a surprise to most people, is that relationship and family breakdown during the pandemic seems to be a big issue at the moment as well. We could just jump through to the next slide again, Jody. So what does this mean for prevention? Well, I guess one of my roles at Beyond Blue is about building mental health literacy, and really that's, I guess that's a big thing that I think that needs to happen in terms of social isolation and loneliness, and improving mental health. And it's understanding that connection is a part of mental health, and it has a big impact on mental health. So I've just popped up there, just on the left-hand side, you'll see a bit of a picture of what has come out of a project that we've been working on for the past 2 years to understand what consists in mental health. So the project was called a Mental Health Continuum project, and it went for about 2 years and had multiple phases that included literature reviews, community consultation, a Delphi study with academics and experts, and also a user testing component. And it was really about looking at how we can frame mental health and well-being as being on a continuum, and understanding that, I guess that everybody sits on this continuum, and from time to time would move from one part of the continuum to another, so from good mental health to poor mental health. And understanding that people all fit on that continuum seemed to overwhelmingly have feedback that said that there was less stigma in terms of mental health, and people found it easier to explain to other people that they felt isolated from about what they were going through in terms of their mental health and well-being. So the reason I talk about that now is because part of that was understanding what parts consisted of mental health. And if you have a look in those sections, we had thoughts, feelings, but also connections. Connections was one of the most important part that consisted of mental health. And the part of connection wasn't just about being connected to supports or being connected to other people, but it was also about being connected to culture and being connected to country that was really important for people, and that kind of impacted on their mental health. If we jump just across to the next and last slide, I just wanted to say, Beck and I wanted to say some things that we're doing in terms of fostering connection with our own community at Beyond Blue. And one of the things that I've been running every fortnight are staff support groups. They're actually, well, we call them virtual connection sessions. So there's a bit of a mental health literacy component to this, and a bit of a peer support component. But basically, we offer a virtual space for people to drop into once a fortnight. We quite often will offer more than one, but it's a place for people to just jump in to connect with other people across the organisation. And we're an organisation of about 230 people, so it could be, it could be connecting from anybody from a different area that you might not have connected with before. But also we teach them about ways to share and manage stress. and different parts about mental health and ways to, I guess, such as meditation or mindfulness, or self-care or self-compassion. And we talk about why these are issues, and we talk about in a big discussion forum about ways that we can implement this during the time of COVID. And I'll just hand over to Beck.
Thanks, Chris. Yeah, like Chris said, I guess, when we were thinking about, I'm going to keep going just on my last slide, but I guess we figured that, when we're talking about what we're doing, what we are doing internally is just as much, I guess, a part of what's driving us, or an important kind of thing to consider as what we're doing sort of out there in the community, because we have to keep our own staff community well and connected during this time. And Chris's sessions have been getting, such enormously positive feedback. So the other thing that we've done is recognizing that people have a whole lot of other stuff happening during this time. Is a little guide to remote working that is extends beyond ergonomic arrangements at your kitchen table, to include things like where people can turn for support for financial stress, for risk taking, managing living alone or managing living in shared accommodation and that sort of thing. We also set up a kind of focused support group for parents and carers who are managing remote learning. So we did this, I guess, earlier in term 2 when that kicked off, and looking to do it again. But we're very fortunate to have some colleagues in our BU, in our schools program team, who are former teachers. So we tapped into that in-house expertise to support families with some tips on how to manage the remote learning situation. And that seems to have gone really well too. So I guess it's been about thinking about how we can adapt and change to actually support our own people through this, as much as it is about supporting our broader community. Thanks, Jodie. That's me done.
Thank you very much, Chris and Rebecca. Really grateful that you're able to share what you're doing internally at Beyond Blue to support the wellbeing of staff during COVID-19, but also the great work you're doing across the community to enhance mental health literacy and prevent issues like loneliness and social isolation. Thank you again. We're keen to go a little deeper into these conversations, but there's really rich questions coming through in the question and answer section. Please continue to post those through. I'm briefly going to throw to David with a question for David, and then we're going to move directly into the question and answer session. David, really keen to understand what you'd add to what Rebecca and Chris are saying about preventing loneliness and adapting to the context of COVID-19 within our workforces. David, what do you think organisations working with the community can do to adapt and transform to COVID-19 conditions now and into the future?
Look, there's quite a lot of things that people can do. Interestingly, the Department of Health and Human Services did a survey just in the last few weeks of neighbourhood houses to find out what kind of activities they were still engaged with in during the shutdown period, and of course that's what we've all gone back to. And you can see here the kinds of adaptions that neighbourhood houses have been able to make. And that number one, the one at the top, obviously is a really critical one. So making sure that they're maintaining contact with particularly those neighbourhood house participants and others in the community that are vulnerable, that are more likely to be adversely impacted by being in isolation. And then there's all those other things, you know, using the technology that's available to keep people connected. And I've even had conversations with neighbourhood house coordinators telling me how some people have become more connected with others as a result of using some of that technology. So, you know, have more regular catch-ups with family members who may be in other parts of the state, the country, or the world for that matter, because they've had to master and learnt to master some of the technologies. But I think some of the points that were made earlier are really important around how it impacts differently for people, and particularly for those with pre-existing mental health conditions. And for some, you know, this is a bit of a blessing because they don't have to engage with other people, but that's a double-edged sword, of course. So it just requires some really nuanced thinking about how we best respond to individuals, really, over the course of this period. I think there's another slide, Jodie, that also goes to your question. So I'm not sure, Tom, if this is where you also wanted me to talk to, but it's up, so I will. There's just a whole bunch of considerations, and this was designed really for neighbourhood houses, but I think it's true for many services across the state, that if we're keen to do this work in the preventative space, it's useful to make sure you have really good networks with referring agencies, making sure that staff understand the issues, know how to recognise and respond, and of course that safe space is fundamental, particularly for those whose isolation is related to either stigma or discrimination or underlying mental health issues. Providing activities for building and maintaining connections, that goes back to what I talked about earlier. So making sure that not only do we create opportunities for people to meet with each other, but also opportunities for people to maintain those connections, and choosing the kinds of activities that, you know, from our research we can see are more likely to provide a rich environment for creating social connections. And particularly in rural communities, I have to say, where there's not a lot of social infrastructure, this becomes important, particularly that maintaining social connections or opportunities to maintain them. Yeah, we need to think about, and there's been some questions around these sort of age cohorts, gender, and the kinds of barriers that people face, and also if we need to then refer on to other professionals where people are experiencing other underlying conditions that are contributing to their anxiety or their isolation or loneliness, and seeing that those can be addressed as well.
Thank you very much, David. So we're going to transition now into a live question and answer session. I'm just going to ask our panelists to switch on their videos. And Jodie, if you can bring everyone live. Chris, I'm going to come to you with a question first.
Yeah, go ahead. Yeah.
Just a brief one. Where can our participants today get further information about the support group for families and the broader research and co-design you're conducting?
So the support group that we're running for families is an internal group that we're running at the moment, but we'd be more than happy to share some learnings from that group. I mean, that's something that I'm not involved in directly, but we have, because we've got an education section section of Beyond Blue for the BU education service that we're running, we've got some teachers actually that are providing some practical tips. We'd be more than happy to get in touch with them and share some of the learnings with that group. Interestingly enough, I'm running a group as well this week that's going to talk to that same group, but less about the practicality of at-home learning and more about the feelings that people are feeling and how they're coping during this time. But yeah, I'm more than happy to chat with anyone about that if they want to get in touch with me after that. In terms of the co-design project, well, it's still a little bit early days to know what we're doing with all of the outcomes of that. But I'm pretty sure we would have some kind of knowledge translation process in place, and I think once we've got those outcomes and they've been finalised, we will definitely be sharing them because I think a lot of the outcomes, and I think you know, one of the things that we've become really good at Beyond Blue more recently is understanding that we can't do everything for everyone, and that we need to share some of our knowledge and share some of the outcomes that come from the research that we fund, so that other people might be able to pick up on some of the things that we aren't doing. So we will make it available. I'm not sure. It depends on when it's all finalised and when the reports are done and everything. So, but lots of our research is published on our website, so you can go and have a look on our website, and we've got different research papers that are up there.
Thank you, Chris. I'm going to stick with you, Chris, and just ask if we can tap into the clinical part of your brain. After we've heard from you, I'll throw to Rebecca and David for anything they want to add. But we've noted through the themes in the discussion that feelings of loneliness sound like many other things that might often be misdiagnosed as mental health disorders. Do you have any advice around how we might distinguish between loneliness and, say, depression or anxiety?
Yeah, I mean, look, I guess it depends in a lot of context what's actually happening for the person. I know in a clinical perspective, I still do some work often for the CAT team out in Western Melbourne, and I think a lot of it's about not jumping to a diagnosis and seeing what other factors might be playing a role in their current mental health, and really about understanding exactly what's going on and the context of what's going on for them at the moment. I think, yeah, I guess you would be looking at trying to address the loneliness aspect and kind of separate that from how they're feeling.
I think it's such an important point that we don't rush to make diagnoses that become labels that people sit with for a long period of time. Rebecca, is there anything you'd add to that?
I guess it's not directly related or not directly in response to the same thing, but I guess, you know, one of the things we talk about a lot is just this kind of disconnection, excuse the pun, that people have about the fact that we all have mental health. You know, it's like physical health. We all have physical health, and we're getting to a point where we sort of know how to look after that. But when you hear mental health, people immediately think mental illness. And I know in terms of, you know, this group, we're preaching to the converted, but I think, you know, what's been particularly kind of clear through this process is just the importance of understanding what keeps you mentally well and thinking about what's in your toolbox. And I think for many people, they probably haven't made that sort of link before about the critical importance that connection, particularly physical connection for many people, plays for their well-being. And so, yeah, I guess, you know, we've been talking about this a lot, and it's hard when you work in the space, you kind of forget that not everyone else is on the same bandwidth as you are. But I think that's, you know, that's just such an important thing that we have to think about moving forward.
Absolutely, and you make such a great point around how we need to invest in the social capital that enables us to have that focus on connection as well as things like physical health. David, would you add anything to distinguishing between loneliness and other mental health disorders, or how we can best treat the issue of loneliness?
Again, you know, I'm not a clinician, so I don't have the expertise of Chris and others, but what the research seems to be telling us is that social connection is important for good mental health. So whether you have an underlying health condition, a mental health condition, whether you have you know, a socially induced state of social isolation or loneliness, participating in activities with other people like they do at neighbourhood houses, like parkrun, like all the so many other wonderful activities. Even I was talking to someone who'd prescribed somebody to a fishing group because that's what somebody was most interested in. So I think, you know, whilst there is a need for clinical support for some people, participation in social activity is part of the solution. And so we just got to be a bit wily, you know. So I know a lot of neighbourhood houses that had never run walking groups, set up walking groups because that was one activity that people could do because it was outdoors and you could do it in a group. So I guess it's around looking for those opportunities and seizing them.
And I can see in the comments that while we're creating those conditions for connection, we also want to be engendering a focus on kindness, compassion, care for one another. So building a social response that facilitates those sorts of approaches is really important. I'm really keen to hear from each of you, and we'll start with Chris, around what worries you most in terms of comorbidity with social isolation and loneliness. What other things might be also going on for someone experiencing isolation or loneliness that really worries you? Chris?
Oh, well, that's a really interesting question. Just firstly, I just wanted to comment about what you said, which I think was a really important line. So the kindness, compassion, and care for one another. But also one of the things that I've realized in, you know, in all of my internal clinical dealings with staff is the kindness and compassion needs to extend to yourself. And it doesn't seem to be, I mean, people are very good at being kind and compassionate to other people, but not to themselves. And I think it's really important at this point in time to remember that that's an important factor, and that's almost a given in terms of looking after your own mental health. I mean, you can talk about self-care and you can talk about mindfulness, but if you're not compassionate to yourself, then you're probably doing yourself a greater disservice. In terms of comorbidity, I wonder about I guess the compounding effect of loneliness, and I guess the fact that I guess that the more you feel isolated, the more you feel isolated, and it kind of is this, you know, this ongoing spiral that and that the harder it is to kind of get out of that. And in terms of mental health conditions, I think it makes it harder and harder to access the support that you might need, whether that be the support of a friend or whether it might be the support of a professional. And so I think that the longer it goes on, the harder it is to get help. And so what I worry about is, yeah, I guess is that the importance of early intervention and how we need to kind of catch it early. But it's easier said than done, really, isn't it? It's about understanding how important connection is and understanding our own mental health and how loneliness impacts on our own mental health. Does that kind of answer the question?
It does, Chris. I think you paint a really important picture and the cumulative impact of loneliness and how somebody experiencing it will progressively experience worse symptoms of loneliness. David, is there anything that particularly worries you around comorbidity with loneliness?
I think one of the biggest challenges that certainly Michelle Lim and her colleagues have identified is where social anxiety is a contributing factor, because that in itself is a barrier to social connection, and unless that anxiety can be addressed, it is 100 times harder for those who experience that to take the steps they need to take. I think the other thing, because I agree with what Chris was saying there, is also taking the opportunity as it presents. So the need to, particularly for people who are well entrenched in their social isolation, it's a very rare opportunity to come across that person understand that there's an issue and do something about it. So the medical profession in particular, you know, everybody needs to see a doctor at some time, you know, making sure that they're skilled up to identify those kinds of things and have the wherewithal and the resources to then prescribe, if you like, which is, you know, a common concept that's gaining some traction in Australia, prescribe some sort of an intervention that may be about social connection, but it may also be about clinical intervention as well. But taking that opportunity as it presents, because if you miss that one, it's back into isolation. So,
David. And Rebecca, is there anything you'd add to round out this conversation?
I think I just reiterate the comments that the other two have made, but, you know, particularly as David said around social anxiety, we've seen that as a really kind of common theme prior to Melbourne's change back to isolation. But, you know, as we were looking, I guess, to see restrictions lifted across the country, there was a lot of discourse online about people's anxiety in having to return, I guess, to what had been normal. A lot of people with social anxiety particularly had, I guess, really sought a lot of refuge in what isolation was offering, and that they didn't have to physically connect in the same ways that they'd had to previously, and that I guess connecting online sometimes can be a bit easier. So I think particularly as we come out the other side of this, optimistically, I'll say, yeah, like David and Chris said, what that means for people who may have found isolation a bit easier than some of us.
Thank you. So I know you're all motivated by this, and all our participants will be also. We're here together because we're all interested in changing the world and making it a better place. I'm really keen to hear from the panel if you've observed any specific examples of whole of community prevention initiatives that are tackling the issues of loneliness or social isolation, and if you can tell us anything about the key factors that make those whole of community prevention initiatives successful. We might start with you, David, and then we'll hear from Rebecca and Chris.
Yeah, well, people are probably aware that the UK is more advanced, I guess, in responding to loneliness as a social issue. And they've been doing quite a lot of work. They actually had a Minister for Loneliness, which is an odd title. I'm not sure that the title is particularly helpful. But there's been quite a lot of work done there. One of the more interesting interventions that really has taken a whole of community approach. I'm trying to remember the name, and I've been trying for the last half an hour to remember the name of the part of England in which this occurred. But basically what they did is took the whole community and or key people in the community like hairdressers and bar attendants, everyone, and train them up in being able to refer people through to the whole range of activities that exist within that local community. So it really mobilized everyone in a sense to help people to get better connected. And they've seen some quite astounding results. So including, if I remember correctly, I think it's a 17% reduction in A&E presentations, admissions, in fact, not just presentations. So quite profound benefits, but a really good model of using the community as what would be called link workers in, you know, social prescription parlance, if you like.
Thanks, David. Rebecca, have you noticed any great community initiatives focused on prevention?
I wish I had, Tom, but nothing comes to mind, unfortunately, other than, as David said, the UK have done some great stuff. But I guess it's the hardest. It's the hardest thing to work out, but I don't know if you can think of anything, Chris.
Well, it's interesting. Just one thing kind of comes to mind, and so a few years ago, Beyond Blue and Movember had similar funding. So Movember was funding Beyond Blue, so the money that raised by Movember was going to Beyond Blue, and during this time there was, I think there was some additional funding that Movember and Beyond Blue decided to run this social innovation challenge for men, and they had gotten groups from all over Canada, the UK and Australia, and had basically helped people apply for this funding pool. I can't remember how much it was, but to design, I guess, different ways to promote social inclusion for men. And I guess the thing that I liked about that, so last year I was lucky enough to kind of see the end of that project. I wasn't working at Beyond Blue when it had started, but I was able to travel around Australia and see some of the sites that that Beyond Blue and Movember had funded within Australia, and some of the projects that were being funded. And one of the things that I really liked about this was that it kind of took a local approach and understanding what the local needs were, and took a very innovative approach, so very inventive ways of doing it. So there was, you know, for example, there was a surfing group for men, or there was a pie group for men, or there was an online gaming, online gaming days. I'm not great with gaming terms, but it was basically like tournaments that were sponsored for men. And I just really liked that it kind of was thinking outside of the box, and it was giving funding to people, or, you know, for different organizations that were kind of grassroots organizations that were led by people within the community. And I think, you know, for me, I think that's where we should be going. I think rather than having a national approach to things, it should be looking at what the local community needs and what the local areas need, and understanding that, and developing the approaches based on that.
I think that's such a good point. We've had comments throughout today's session around how different cultures, different communities, different social groups will experience loneliness differently. And I think it's so important that we have local place-based solutions to prevention of loneliness. We're running low on time. I'm sorry to all participants that we haven't been able to address all the themes that are coming up today. But in closing, I'm keen to hear a final thing from each of the panelists. And that thing is, what one piece of advice would you have for our sector in dealing with loneliness in self or others during the context of COVID? What final piece of advice would you have for us in dealing with loneliness within the context of COVID? Rebecca, are you happy to kick us off?
Sure. I guess the thing that comes to mind is, you know, I guess what COVID has done is leveled the playing field a bit. You know, as workers in this space, you know, you don't always experience what's happening to your clients or to your communities in the same way. But I guess we're all going through COVID together, and it has really made all of us recognise how important connection is, whether that be, you know, in your workplace, with your colleagues, or with friends and family and so on. So I guess as an optimist, I'd say it's a really great time to think about what's important to you, what your, you know, what makes you feel well, what prevents you from feeling lonely, and what are those important things, I guess, that you can, you know, tap into when you need to. It's almost like making your own little plan that you can have at the ready. And I think that, you know, that's something that you can do personally. You can do it with your colleagues, but you can also think through in terms of the community that you're dealing with. I guess it's a really important time for us all to think about what we need in our toolbox to make sure we can stay well.
Thanks, Rebecca. And David, what would you add? What's your key piece of advice?
Look, I think we're challenged to do things differently, but there's a hell of a lot still going on, you know, and so there are still many, many points of engagement for people, many kinds of activities they can do. And I agree with what Chris was saying, you know, it's those local solutions. I think that's part of the success of the Neighbourhood House story over, you know, 40 plus years now, is that capacity to respond to immediate community need in a way that the community can shape, you know. So we end up with everything from men's sheds to Certificate 3 in early childhood education coming out of the same organisation. But beyond the neighbourhood house sector, there are still many people providing opportunities for connection and resourcing people to develop or maintain their connections, even if that's just through teaching people how to use those technologies. So I guess make the most of what we've still got. There's still a lot of infrastructure in place, social infrastructure in place. It's different, but it's in place.
Thanks, David. And Chris, what gem do you have for us?
Look, I don't know if I guess this is kind of loosely related to loneliness, but I really want to reiterate the importance of self-compassion, and I think I think I mentioned it before, it's something that we kind of don't practice enough, and I think if we're not practicing that, then we can often feel isolated from ourselves. And I think if we are more kind to ourselves and we practice self-compassion and teach others to practice self-compassion, that if we're not feeling you know, if we are feeling lonely, then at least we have ourselves as our, you know, we're on our own team, you know, otherwise we're not on our own team. And then that can make things worse, I think, quite often.
I think that's such a good point and really important you raised that earlier in the discussion. Look, I'd add to this by reminding everyone how gentle we need to be in working with people who are experiencing loneliness and social isolation. Rarely is loneliness a feeling that you come by overnight. There is such a thing as situational loneliness, where you're responding through your feelings to a specific life transition, like loss of a loved one. However, it's rare that feelings of loneliness will just spark up immediately. Often, as Chris was talking about, they present over a long period of time, and the longer they're around, the harder they are to deal with. So when we're working with individuals and communities who are experiencing loneliness, it's important that we're very gentle in our expectations of people to make changes in their lives to tackle loneliness. It can feel frustrating because we know the antidote to loneliness is connection. Why can't people just get out there and connect with one another? But there's so many barriers to that connection for so many people. And as our participants are saying, that's going to be felt by different types of people in different ways. So I think having that compassion itself, but also the compassion for others and being really gentle in our expectations of our treatment plans for loneliness is very important. Unfortunately, we've come to the end of our session today and we can't hear more from our panelists, but I just want to thank you, panel, Rebecca, David and Chris, so much for your time today in talking to us about these issues and also in preparing to talk to us about these issues. And thank you so much to your organisations for the great work that you do in tackling loneliness and social isolation in Australia. I'm just going to move into some next steps. So today we've talked a lot about loneliness and social isolation. We've talked about how that they're different, but the key difference is social isolation is an objective quantification of a reduction in social networks, where loneliness is the feelings that come up through that experience, regardless of how many networks we have around us. And I think we're hearing that what we're really wanting to tackle systemically is the feelings of loneliness that many people present with. We heard from our panel that there's different ways we can prevent loneliness, particularly within the context of COVID-19. Through virtually connection, through psychoed, and really importantly, by connecting with the systems around individuals who experience loneliness, by working with families as a primary example. We would love to have heard more. Loneliness is a global issue. It's a big thing to talk about. We'd love to hear more in the future about the different protective factors that culture brings in, or the different risk factors that different kind of social experiences can present. But unfortunately, we haven't had time for that today. Jody, can you bring up the slide around resources and links, please? And as Jody brings up the slide, I just want to acknowledge that, that to David's point, 1 in 4 people are likely to experience loneliness. Within our participants and presenters today, it's likely that we've experienced loneliness ourselves, and it is a key issue to deal with. We're hearing that self-compassion is key, but if you're having difficulty in finding that compassionate voice or in managing feelings of loneliness in yourself or others, please do make sure you make the time to reach out for support. And we've put some key contacts up on the screen now who can offer support around experience of loneliness and isolation. What's next in our community of practice space? Well, I'd like to forecast that through September to October this year, Family Life will be facilitating some professional development training that supports you in being change makers and developing the skills and experience to effectively lead community change. We'll be giving you further updates on this through our website, so please stay tuned to our website or mailing list to get updates on how you can participate in that professional development training. In follow-up from today, in a few days, you'll receive a follow-up email, which will include a link to the audio recording of today's call, as well as some of the learning opportunities I've just mentioned. We'll include in that link a link to a SurveyMonkey so that you can give us feedback on today's session, and we can hear more from you about the different topics that you'd like to see us explore in our Community of Practice series. We're really keen to make sure that we're tailoring these sessions to the needs of our community of practice. We want to continue to collaborate. So please use the survey or get in touch with us directly to recommend any other themes. And we're more than open to facilitating further Community of Practice series in the year that meet the themes that you're wanting us to address. And please stay connected to our website for all broader upcoming events. Once again, I want to thank Jody and Asher for facilitating today's event, and David, Chris and Rebecca for their time in joining us today. It's so important that we're talking about this key issue and hearing more about how we can resolve issues of loneliness in our individual communities. Finally, I want to once again thank all our participants for joining the conversation, for all your comments and questions throughout the session that have meant the discussion is as robust as possible within the timeframes that we've had. Please do take care as you continue to manage the context of COVID-19 and transition beyond that context into the new world order beyond COVID-19. Thank you all so much for your time and have a great day.